Hello, everybody. Are we live? Let's see. Okay. Hi, hi, hi. Happy Friday. I'm just checking that our tech is working. Yeah, it looks like it is all good. Amazing, amazing. And welcome to today's Wonder Why Lunch and Learn series, although we're a little bit past lunchtime in Toronto. But I think with our guest today, Dr. Valerie Cacho, she is in Hawaii, I believe. She will be joining us in a minute. And so it's probably closer to lunchtime for her. So welcome to today's Lunch and Learn. I am Tracy Cider. I am creator of the Reshape Method, which is my biomechanics-based movement method to help women in peri and menopause look better, feel better, and age audaciously, especially women who are stuck behind screens. We want to have a strong, agile, pain-free body to match your strong, agile, useful mind so that you can crush these next phase menopausal third age work and life goals that you have. But of course, these goals are very, very difficult to crush if you haven't had a good night's sleep. And sleep can be eluding many of us at this age and stage of our lives. So I'd like to introduce our guest today, Dr. Valerie Cacho, who is an integrative sleep physician and perimenopause sleep coach. Hi, Valerie. So wonderful to have you joining us today.
Hi, Tracy. Thanks so much for having me here and talking to your audience. I love talking about women's sleep. So glad to be here. And I'm one of those women who are stuck behind a screen.
We need a chat. We need a
chat.
Definitely.
Yeah. So today
Dr. Val, tell us a bit about you. You're based in Hawaii. Is that correct?
Yeah, actually, I'm Hawaii and California. So I do have my office. It's physically located in Hawaii, but yes. I am now in California. So I moved November of last year. Yeah, and I'm working on setting up a practice in California as well. So yeah, I do telesleep services for patients or people who are in Hawaii and California.
Yeah. Amazing, amazing. So tell us how did you get into sleep as a specialty, and then peri and menopausal women as a micro specialty?
Yeah, that's a great question. So how I got into sleep, I grew up in a family of healthcare workers. My dad is a physician, my mom is a nurse, I had some uncles who were dentists as well. And I was really interested in having a decent lifestyle. So my dad is an interventional cardiologist who would be up in the hospital 2, 3 a.m. because someone came in with a heart attack, right? And I didn't want that life. I really didn't want to have to be rushing to the hospital. And when you take a look at sleep medicine, I'm definitely more into type of preventive medicine, primary care. I was an internal medicine doctor, then I did a sleep fellowship. And truly, there's no sleep emergencies. I guess if you can't sleep, some people do go to the emergency department and talk to the ER doctor, but it's nothing that is super urgent where I would have to wake up for my own sleep and then go to the hospital. Right. So I thought that,
and yet it's so crucial to the health of to just about everything, right?
Exactly. And that's what I want to go into, because it's the relationship between our sleep and our metabolism, our ability to move our body, how our brain performs. It's so important, and it's often not talked about. So when I was taking a look at my career, I definitely wanted to focus more on wellness rather than acute ICU type care in the hospital. And sleep is really just that nice combination. And not a lot of people know about it, prioritize it. And even in medical school, we had maybe about 2 hours to learn about it. Wow. And then it wasn't until I was actually practicing full-time in Hawaii, I was a medical director of a sleep lab. And a lot of people that I started to see who had difficulty sleeping were midlife women, right? And they were sort of the patients that their primary care doctor wasn't sure what to do with. And, a whole host of issues, definitely stress. Sometimes they had palpitations, sometimes, right, they were caregivers for their parents and for their kids, and they were also trying to work full time. So there was a lot of issues beyond just the physical symptoms, the whole psychosocial symptoms. And, I was a neuroscience major in college, and, the whole behavioral, emotional aspect of health was really interesting to me. And so, yeah, I just sort of fell in love with wanting to treat woman, because there was such a huge need. And then seeing myself like in a couple of years, knowing that it's just around the corner, and how can I prevent any type, or maybe even reduce, right? Sort of that third phase of our life, that next transition. How can we ease into it as peacefully and gracefully as possible?
Absolutely, absolutely.
Where I am now.
Fantastic. So the title of our talk is Sleep, Your Superpower. Menopause and menopause, and how to get more of it. So I am going to hand over to you. I know you have some slides.
Okay.
We have quite a few people watching with us today, and I'm just going to check the chat on all the different social media that we're streaming to. If anybody has any questions for Dr. Bell, just pop them in the chat and we'll ask her. You can always come back and just type #replay. I know a lot of people will be watching on the replay, and Dr. Bell will come back and answer your questions. So let me hand over to you. Let's see if you can share the screen.
Perfect. Can you see this? Okay, so sleep through perimenopause and menopause, and yes, how sleep can be your superpower for wellness and health. So let's get started. Thank you so much, Tracy. So yeah, if there are any specific questions of what I'm talking to, just go ahead and feel free to interrupt me. So just a little bit about myself. So thank you so much, Tracy, for that nice introduction. I also practice integratively. So I know about sort of Chinese medicine, a little bit of Ayurvedic medicine, about supplements, mind-body practices. And I like to think of integrative medicine as all the things that we didn't learn in medical school that can help someone heal. And then so I combine that with my sort of Western view of medicine with my special interest in sleep. And I've also worked as a internal medicine physician as well. And just a disclaimer, even though I'm a medical doctor, I'm not providing any medical care here. So this is all education. If something does come up that is a medical concern, please talk to your doctor or a healthcare professional about that. And so with that said, let's learn about sleep. So this is a little bit of a roadmap where we'll go today on Sleep 101. So, and then we'll move on to a little bit about perimenopause, talk about some of the disruptors, why women do have a hard time sleeping during this time, treatments, and then ending off with a little bit of a self-check-in. So hopefully I'll talk pretty fast to get through all my slides. I always have a lot of slides. So sleep 101, why do we sleep in the first place, right? What's its biological function? Sleep physiology, that's sort of what happens from a science standpoint in our brain and body. What are the different hormones of sleep? Something called the phase response curve, and then a little bit about sleep disorders. So I love this title, The Simplest Way to Drastically Improve Your Life, More Sleep, right? So this is actually taken from a writer, Tim Herrera, in the New York Times. And he says, imagine this. Someone walks up to you and pitches you on a brand new magical pill. This pill can measurably improve your memory, your overall performance, your ability to learn new information, right? Your receptivity to facial cues, right? Being able to understand someone, the nonverbal cues. It can affect your mood, your ability to handle problems, affect your metabolism, right? Something that we get concerned about as we go through menopause and midlife. And how about your risk for heart disease and your immune system, right? If this quote doesn't summarize, why sleep is your superpower, then definitely just keep listening. So sleep can really impact all these different aspects of our health, like our brain health, our emotions, our heart, our immune system. So some of the highlights of why we sleep: we actually consolidate memories. Sleep actually helps our brains file events from the day from our short term to the long term. And it helps us learn and make better logical decisions. And if you may not notice this, if you're sort of a decent sleeper, try to get a bad night of sleep or stay up all night and then see how your brain functions. Because you may not notice the importance of sleep until you get sort of an awful night. And then you really start to feel sluggish. I know for me, sometimes I have 2 young kids. And if, one of them is up all night crying for whatever reason, or if they're sick, sometimes simple things like spelling and grammar just sort of go out the door.
Oh, yes.
I'm asking my husband, how do I spell this word? It doesn't look right, but it's just, when you're sleep deprived, your brain just doesn't flow. The processing unit doesn't flow as right. And one of the great parts about sleep, we have this system within our brain called the glymphatic system. I like to think of it as the trash collectors for our brain. Some people think of it as the shampoo. So during our deep stage of sleep, the trash collectors come out, the shampoo comes out, and it cleans out all the toxins that are built out through the day. So if we're shortchanging ourselves from sleep, either through our choices, not getting an adequate amount of sleep, or if we have an underlying sleep condition where we have disruptive sleep, that can also affect our ability to clean out some of those toxins and maybe associated with things like dementia. Balance our hormones. So there have been studies in college students where they slept deprived them, or even the nurses' health study, typically overnight nurses, right? When you work in the hospital, you don't sleep as much. They actually tend to crave more sugary foods, the simple carbohydrates, right? Because your body sees it as quick fuel. But really what your body's craving isn't necessarily fuel, it's actually rest. And so the hormones that I'm discussing are ghrelin and leptin, right? So ghrelin, think of it like a gremlin, makes you want to eat more, that goes up, and then leptin puts the brakes on our appetite, that goes down. And then strengthens our immune system. So when I worked as a primary care doctor and I'd have people come in, in flu season or maybe not in flu season, I would sort of evaluate their sleep as they had a cold. Oh yeah, I haven't been sleeping as much because I got this big project at work, and you catch a cold, and it's almost like your body telling yourself you got to slow down. And they've actually done research through the University of Pittsburgh, where they took healthy adults and they actually gave them the common cold, right? They put the cold in their nose, and those who slept more than 6 hours on average, closer to 7, were less likely to get sick. But if you slept less than 6 hours, and it was like 3 to 4 times fold, right? So sleep is the superpower for your immune system, right? Keeps you from getting sick. And it's really a vital component to overall health and wellness. Sleep is important as drinking water, right? Getting sunshine, getting fresh air. And if we don't get enough sleep, they don't do studies like this in the past, right? I think now we don't do it anymore, but it's a form of torture for prisoners, right? To sleep deprive them. You sleep deprive rats, and what happens? They actually die because it's such an inflammatory part to your body. Your heart needs to slow down to relax. Your breathing needs to slow down and relax as you sleep. So some of the big reasons why we sleep at night. So sleep physiology, what happens in our brains and our bodies when we sleep? Well, simply stated, sleep happens when our brain waves slow down, our muscles relax, and then we lose consciousness. And that's it. It sounds simple, but there's a lot that goes into it, and I'll break that down a little bit more. There are 4 stages of sleep. Stage 1, stage 2, stage 3, and then REM sleep here at the bottom. And these are EEG. So if you came to a lab and we put the leads on your head, little stickers on your head, what we're looking for is how fast or how slow the brain waves are firing. And sometimes women, men as well, come to me and it's like, I can't, figure out why I can't go to sleep. And sometimes, they may not necessarily have that self-awareness, how stressed out they are because they're chronically stressed. And so when I invite them to think about, okay, what's going on in your life? Sleep is when your brain waves are slowing down. What's keeping your brain waves from slowing down? Then sometimes a light bulb goes up. There's a whole different host of neurotransmitters that are involved, which I won't go into. They're basically just proteins and signals in your brain. But guess what? As we do get older, our sleep architecture, these sleep stages do change, right? So, going through the menopause transition, perimenopause, that can affect our sleep. But aging in and of itself, we have less deep sleep, which is the stage 3 sleep, and then less REM sleep. Yeah. So Mother Nature, gifts of Father Time, can also contribute to that. One of my favorite things to teach folks, patients, and clients that I work with is about this. It's the sleep-wake cycle. So it's a little bit of a busy slide, but I promise you I'll break it down so you'll understand. And the top part is a sleep drive, and the bottom part is your circadian rhythm. And think of that just like your internal clock. So these are the 2 biological processes within your body that control your sleep and your wakefulness. So sleep drive, and I have my water bottle here because this is a great example of your sleep drive. So let's say, you slept 7 to 9 hours. That's the recommended time last night. You wake up, you're feeling great. As the day goes on, right? Think of it, now my water bottle's empty. It's slowly filling up with water, right? And so the arrows represent that pressure that's building up, right? That's building up and building up and building up. The longer we're awake, the sleepier we get. So if you're, had a really busy morning and you have the opportunity to take a nap, you're relieving that pressure. Say that nap is, 3, 4. If you nap, maybe a little bit too long, what happens is that the level goes down. And then when it's, 10 o'clock, 9 o'clock, you're wanting to go to sleep, guess what? You're not tired because you've already relieved some of that pressure. So it's harder to fall asleep if you take a nap maybe too close to bedtime because you have to wait to build up that pressure again. That's one thing. The other aspect, and this is something that I probably see a lot more often as we get older as well, is, I'm getting about 5.5 hours of sleep, maybe 4 hours, and then maybe, my bed partner snores, a dog barks, or I have to wake up to use the bathroom. And now I can't go back to sleep. Why is that? Or what's going on? So, well, as you go to sleep, right, that pressure goes down, right? You're relieving that pressure. And so there is something called the core sleep time, about 5.5 hours, maybe 4 for some folks. If you wake up, it's harder to go back to sleep, right? Because you've relieved some of that pressure. Just like, right, your phone. Your phone can be at 50%. You can text, you can watch, you can go on YouTube, you can go on Facebook and watch lives. Maybe not as high of efficiency as if your battery was charged 100%, but it can still function. So we have that within us. That's your sleep drive, or the homeostatic regulation of your sleep. Guess what? If you move your body, if you exercise, if you exert yourself, right? If you're not just sitting behind a screen, the byproduct of that is adenosine. And adenosine is actually part of that pressure that builds up. So exercise and movement is really good for our sleep. And it's also good for our stress, right? Releases some of those happy hormones. Going on to the bottom side here, the circadian rhythm, right? As that pressure starts to sort of flatten out, you see how melatonin is peaking. Now, what melatonin is, and it's really interesting. In some countries, I understand, not like the US, you need a prescription from a doctor to get melatonin. Here in the US, you can go any drugstore, Target, Walmart, and buy some melatonin. Melatonin is the hormone that's released in response to darkness. What it does, it helps regulate those sleep stages. It's anti-inflammatory. It can actually help maybe lower our body temperature as well to help support the sleep. We like to think of melatonin as the person that starts the race, right? It's the person that goes, the gun, okay, let's go. But it's not necessarily a sleeping pill per se. Sometimes it's mixed with things like hops, passion flower, chamomile that are more sleep promoting. So it can have some of those effects. One of the most important things to think about as we get older is, there are studies that show we have a decrease in release of melatonin. Yeah. So should we take it? Well, depends on the reason why you can't sleep, which I'll go into a little bit later. But melatonin is considered a Zeitgeber, and that's a German word for environmental cues that can support sleep. So light, darkness, and melatonin are really important. But guess what? Light is a stronger cue than melatonin. So what's my recommendation? I'm sure you've heard a lot of people talk about this now, is make sure you get your morning sunlight, right? The morning sunlight tells your brain, it's got to hit your retina, it's got to hit your eyeballs. It's time to be awake. It's time to be alert. The more sunlight you get during the daytime, it sets up your system better so you can sleep better and even earlier at night. If you're more of a night owl, basically get more sunlight. And if you live in a place where there's not a lot of natural sunlight, you can buy a light box with 10,000 lux, and that's actually really helpful. Yeah, so I definitely always recommend to use like the natural things as much as possible, right? So you don't have to buy melatonin, buy a light box if you live in a place where you get a lot of natural sunlight. And then
so
the same thing.
Is the light box just to get light in your retina? It's not doing anything else other than that?
Yes, if we're talking in the context of sleep. People who have seasonal affective disorder, right? People who live in environments where it's really cloudy, it's dark a lot of times out of the year, tend to have depression, right? And so light can actually also help lessen that. So yeah, if you have a mood condition related to the weather change, then light can help. But in the context of just sleep, light hitting your retina tells your brain it's time to wake up and alert. Yeah, and so then avoiding light boxes.
So those light boxes are just bright lights. Is that all they are?
Exactly. Yeah.
Okay.
And you want something that's at least 10,000 lux. Yeah. I'm sorry, go ahead, Tracy.
All right, because I've got studio lights here, and I'm wondering, would those do the job, or is there something particular about a light, a specific light?
Well, potentially it can. I mean, depending on how bright you have it. There's an app called Light Meter where you can, sort of, or even like, not even an app. I guess there's tools that you can like measure the light. And you can, turn the light off and then turn the lamps on and then be by the window and then go outside. So about 10,000 lux is what we say will maybe get the natural sunlight. Yeah.
Fantastic.
So if you are doing sort of a live or any type of training, an hour close to your bedtime and you have a hard time going to sleep, it could be because of that light, right? Light delays the release of your melatonin, right?
Uh-huh,
So
uh-huh.
something to consider. That's what I always talk about, right? If you're on your phone, decrease the darkness, wear the blue light blocking glasses. It can help. Yeah, great question. Yeah, but I think, if you are able to get light in the morning plus move your body, I think that's beneficial, right?
Absolutely. Yeah.
It's hard to be sleepy when you're moving, right? I mean, some people can be, but then they probably have a medical sleep condition if you're falling asleep.
And in the Reshape method, we do really recommend that people go for a walk before work, even if it's just walking around the block, right?
Exactly.
It's that sunlight, it's the change of temperature on your skin, whether that's colder or like being in the house, also having the same temperature all the time is not great.
Yeah.
Your body needs to be able to, as you say, respond to these different waves. It's meant to go with these ebbs and flows, right?
Exactly. I like that. Yeah.
I've also heard, and some people have mentioned in the comments, that they take melatonin and then it started working and then it stops working.
Yeah.
What's the story with that?
Definitely. Well, it depends. I always ask why you need to take it. But sleeping pills in a whole, and melatonin's not considered a sleeping pill. Your body potentially can have what we call tachyphylaxis, is you get used to it, right? And then it may not have the same effects after a while. But also the thing about melatonin, it could really also depend on the manufacturer and where you buy it. There was a big study in 2017 in the US where they took, a bunch of different brands of melatonin, and what the manufacturer said that someone was getting actually wasn't even, that percentage, up to like 40% versus like 400%. Wow. Yeah. So quality standards, right? Because it's not an FDA approved, it's sort of regulated like a food here. So that may be something to consider. What else? And yeah, I mean, this thing can happen the same thing when we take sleeping pills too. Sometimes your brain is just so powerful, it can overcome those chemical effects, right? Like if your stress response is so strong, a pill, even like melatonin, may not be helpful, right? Because that's just one aspect. So there's the sleep drive, there's light, darkness, and melatonin. And then the third aspect that impacts your sleep is your environment, right? Your thoughts, your body, right? So it's a really sort of packed question. Yeah. And it just depends. Yeah. Yeah. Depends why you're taking it. So yeah, Center for Sleep Deprivation, right? The lights that we get from our phones, from our screens, can definitely impact the quality of sleep that we get. Yeah. Any other questions, Tracy? No. Okay, right perfect. Yeah, good. Yeah, so hormones are messengers. So they're basically just proteins in our body that move from, different organs, like down from our brain, down to our, ovaries, and so forth. So the specific hormones of sleep, growth hormone, definitely goes up when we sleep. But then as we get older, we have decreased levels of growth hormone. Ghrelin and leptin I talked about, those are the hormones that affect our appetite and satiety. Insulin and cortisol, those affect our blood sugar and the stress hormone. Aldosterone, antidiuretic hormone, those affect our blood pressure and also our fluid balances. And then melatonin that I talked about as well. So going a little bit into sleep and cognition, I may just go over this pretty fast because I think I want to talk about the medical sleep, but cognition is the way you think about something. And when you don't get good sleep, right, your attention goes down, and this affects all ages. Caffeine can help, but it may not actually completely reverse that. Caffeine blocks adenosine. So, and adenosine, right, it's that pressure that builds up. Our memory, right, our memory can be degraded. When we don't get enough good sleep, we may be able to recall incorrect information. So if you're a student, or if you're a teacher, or if you're, the parent of a student, make sure they're getting enough sleep instead of pulling all-nighters, right? You actually do better on test. I remember I didn't know this information when I was in medical school. I would definitely stay up all night because I felt like, I had to cram all this information. And I remember falling asleep during some of my tests. So not the best. Sleep and the heart. There's a lot of information about, as we go through menopause, blood pressure concerns, more risk for things like heart attack. And guess what? When you don't get enough sleep, and this is typically about 6 hours or less, your rates of high blood pressure can increase, right? And sleeping longer may actually be the antidote, right? Maybe you don't need to be on a medication that can have a lot of untoward side effects. Maybe you just need to sleep longer, right? Because if you think of your body like a machine, you don't want it running full speed all the time, right? It's got to have, even your computer, right, has a sleep mode, has a quiet mode. The fans has got to turn off, it's got to cool down. And we even see physical changes like calcifications of the coronary arteries. So those are the arteries that supply oxygen to the heart. When you don't get enough sleep, they start to harden. And that's not good because then the blood flow doesn't blood flow as well. And it's associated with higher morbidity and mortality. So being more sick and dying sooner if you're not getting enough sleep. So it's a superpower for your wellness, right? And it's available to you. Getting more sleep is good for longevity. So the medical sleep disorder. So this is sort of what I see in my medical practice on a regular basis. Obstructive sleep apnea. So it's all in the name. There's a physical blockage of your upper airway. Typically it's the tongue. Insomnia, that's difficulty falling asleep or staying asleep, associated with daytime consequences like affecting mood, cognition, work performance. Restless leg syndrome, we do see this in higher rates of women, but typically pregnancy, not so much through menopause. It's associated with having low low iron levels. It's a creepy crawly sensation that can keep you from falling asleep. Narcolepsy, we don't see as often in midlife, happens more in the younger population, but sometimes people can be improperly diagnosed or not diagnosed. And what it is, it's a disruption through the different stages of sleep, right? There's 4 stages, 1, 2, 3 in REM. You go through that in that normal order 4 to 6 times, depending on how long you sleep. With narcolepsy, you're awake and you're asleep sort of all at the same time. It's all jumbled together. So regardless of how long you sleep, if you're still tired, that's narcolepsy. And the treatment for that is with medication. So if that's a concern, definitely talk to your doctor about it. So obstructive sleep apnea, it's pretty common to have in adults. And what I really want to highlight is as we go through menopause, it gets worse. So rates may double or even triple. Why is that? Because estrogen and progesterone are protective for our upper airway. And as those hormone levels decrease, the tongue can get more floppy, the muscles of the throat can narrow and collapse. So snoring is not normal. Everyone, if you do snore, I would encourage you to, and also if you're tired and if you have high blood pressure, talk to your doctor about it. Snoring in women has been associated with high blood pressure. Right. So we want to make sure you don't have an underlying obstructive sleep apnea. It's a little bit more severe than snoring. Why? Because you could have lower levels of oxygen. And oxygen is basically the food for all the cells in our body. Your brain really needs oxygen. Your heart really needs oxygen. So when you're asleep, we want to make sure that your body is in the most optimal state to be able to live and survive and thrive. Yeah. And so one of the big issues with sleep apnea, it's not commonly discussed. Only 12% start talking about this with their physician. And then 1/3 of doctors actually bring it up. And women even more so. I read an article not too long ago. It was, a man who was overweight and obese talking to their doctor about being fatigued. They get a sleep study. A woman goes in, same symptoms, says the doctor will go, oh, maybe you're depressed. Try this pill, or let me check your thyroid pill, but they don't really screen them for sleep apnea. And it's a really treatable condition. So what are some of the physical signs and symptoms? You can have a really small jaw or chin, very large tongue, tonsils, a crooked nose, and then the neck size. So for women above 16 inches can increase your risk. This is something called the Mallampati score. So if you snore and you have a hard time seeing the uvula, the little hanging ball in the back of your throat, and if you just see your tongue, that can increase your risk. Typically, right, it's because the tongue falls back. So when I talk to my patients, I say, okay, imagine yourself in a room. And now this room is half the size and the walls are collapsing at night. So if you start off with a smaller hole and it collapses, more likely to snore and have sleep apnea versus if, the room is the size of a ballroom, right? And the walls collapse, more space to walk around. So that's really important. And it can run in the family, right? Because if you look like your mom or your aunt or your grandpa who snored and they have small chins, then that could be a hereditary component as well. So all the different signs and symptoms, so stopping breathing, snoring, choking, gasping, having a hard time staying asleep. If you have a hard time falling asleep, it's not sleep apnea unless you're worried about going to sleep and not breathing, because it only happens when you're actually asleep. Feeling tired throughout the day, having headaches, memory issues, poor concentration, and then what's here at the bottom? I have a little thing that comes up. So, sorry, I can't see what that says, until it goes away. But the thing about for women is that their symptoms are a little bit more subtle. So you actually don't have to snore to have sleep apnea. Sometimes women, what we see is they're concerned for being fatigued. Oh, urinating at night. I'll talk about that one. That one's super key. So women can have just some headaches in the morning, some mood tiredness, and feeling a little bit fatigued. And that could be their symptoms for sleep apnea. When I used to work in the hospital and I would admit folks who come to the ER, I remember having a woman who had a heart attack, and she didn't have the crushing pain in her chest radiating to her arm or sweating. She was nauseous and dizzy. And good thing the ER doctor checked her EKG, her blood work, and that was her sign of having an acute heart attack. So we do present a little bit differently, and it's so common. I almost think everyone should get a sleep study, and you can do it in the comfort of your own home. So urinating at night, right? As we get older, what happens? We have decreased levels of estrogen that can affect our urethra, right? So we may be prone to more UTIs. But sleep apnea can contribute to this. Why? Because imagine your throat like a tube, and what happens if your plumbing is blocked off? Downstream, there's more pressure. So when you have more pressure in your lungs, it puts more pressure on your heart. Your heart will actually stretch and send a signal down to your kidneys to tell you to wake up and urinate. So if you urinate more than 2 times a night, that could be really devastating. Not even 2 times a night to have to wake up is awful, but there could be a mechanism for that, maybe a hormone issue, maybe your tongue issue, and it's worthwhile to get looked into. A lot of people that I talk to and I ask, they're like, oh, well, I just drink a lot of water. My doctor says I need to drink a lot of water. Yes, it's good to drink a lot of water, but your brain can also tell you not to wake up and urinate. So something to be mindful of. Yeah,
absolutely.
More than 2 times a night, I think, is something that you should get checked out. So what happens if you have a sleep apnea, we don't treat it? Well, it affects your heart, mainly because you don't have enough oxygen going to your heart. So high blood pressure, heart failure, irregular heartbeat, stroke, that's essentially like having a heart attack in your brain. Your brain doesn't have enough oxygen. Diabetes can play a role. It can affect your blood sugar levels, and then thyroid issues as well. So a lot of things that can play a role. How we test for it, you can go either in the lab or at home. A lot of insurance companies prefer the home test, which is nice because you get to sleep in the comfort of your own home. So you can have just something on your wrist like this. Typically, people who are pretty sick, if they already have heart failure, act out their dreams, they go to the lab. But most people can sleep at home. And then one of the biggest concerns is, oh, do I have to sleep with that big thing on my face if I have this, right? The whole Darth Vader mask. They do have masks that are quite big. Let me see if I have a mask handy for me. But there are really small masks that actually just sit underneath your nose like this. So this one is on the smaller side, but really the machine is the best treatment option, because think of it like this waving arm balloon, usually by the car dealerships, right? At night, think of your throat like a balloon that just collapses. And all the machine does, it just blows positive airway pressure in.
Right. Yeah. We have a question here.
Sure,
well, it's not a question, it's a comment here from Patricia. She says, I've tried numerous sleep studies, tried everything recommended for years. You have an issue when the sleep technician feels sorry for you.
Oh, yeah. So, yeah, and I think what I would say to that is hopefully you can find a practitioner that is compassionate and will work with you with your concerns, whether it be sleep apnea, whether it be insomnia, or another underlying sleep.
Yeah. And I love that your approach is integrative, right? Because often if nothing is coming up from an allopathic perspective, doctors will just go, I don't know, right?
Exactly. Yeah.
Whereas you bring in other modalities as well. So
which we'll go into. Because I think there's always hope, right? I think that's something that I like to help patients realize, that sometimes, you go through the whole healthcare system and you just lose confidence in yourself, and you think we've tried so many things and nothing works. But I think there's always opportunities to learn and grow, and keep searching. Yeah.
Right.
Yeah. For some people, they just need to sleep on their side or sleep a little bit upright, and that can help. So bed elevation, mouth guards can help, and then certain surgeries. So going to insomnia, if there's no other questions, but insomnia, right? Not all women have sleep apnea. Sometimes it's just our ability to fall asleep, stay asleep. And, women have higher rates of mood disturbances. So anxiety and depression, and those go hand in hand with difficulty sleep, right? If you're really down and depressed, you want to sleep all day, and or if you're really tired and you don't get good quality sleep, you feel depressed because you don't have enough energy to do anything. Versus if you have anxiety, right, your brain is really active, it's hard to slow down, and that can keep you from falling asleep. Yeah, and insomnia is really important because then it can affect our work. Like, I know people who have like called in sick, maybe they got in accidents because they just haven't been able to figure out how to get better sleep. And like I said, there is definitely hope. So some of the best treatments are something called cognitive behavioral therapy, and that's learning how to sleep again. Sleep hygiene and sleep education can definitely help. I always encourage people to develop a sleep routine. I'm sure Tracy probably talks about this. Well, as you're moving your body, you probably just don't go to the highest intensity thing right off the bat. You probably want to warm up, move your muscles. Same thing for sleep, right? We go throughout our day from one moment to the next, so that as soon as we put our head on our pillow, we expect that we should be asleep. But your brain needs to slow down. It needs to have that warm up to the point where you have this wind down routine to allow yourself to be more at rest, more at comfort, right? Try not to do work up until going to bedtime, right? Yeah, that definitely doesn't help unless you have a really relaxing job, I guess. Part of cognitive behavioral therapy includes relaxation therapies, movement. Integrative therapy can include things like herbal supplements, mind-body practices, body scans, acupuncture. Those have all been shown to help in women as well. Yeah, so going back to our roadmap now, talking about perimenopause and menopause, which I'll go briefly, but basically there are certain definitions. Perimenopause in the US, the average age is about 51. Perimenopause is 47, 48. Menopause is actually just one day when you don't have your period after a year. It can be difficult to diagnose because like if we don't have our uterus anymore, because if we had fibroids, if we have an IUD, you don't really know if you're having regular periods. Surgical menopause is when you have your ovaries removed. So if you still have your uterus and if you don't have your uterus, but you still have your ovaries, that's not considered surgical menopause. You have to have all of the female parts taken out. Yeah. And so what happens? Well, our hormone fluctuates. So up until we go into menopause, typically at 51, the levels of our hormones can go up and down. So sometimes people ask, should I get my blood work done? And some doctors don't even check because it may not be helpful if you're still having regular periods. There are different levels of the FSH estrogen when you do go through perimenopause. They're typically a little bit lower, but depending where you are, the blood work could be normal, but you could still have symptoms of perimenopause. So just know that. But when you are actually in menopause, FSH, the high levels of FSH is really what's telling. Yeah. So the symptoms of it, right? So hot flashes, headaches, bloating, waking, insomnia, joint pain, depression, anxiety, concentration, memory loss, reduced sexual function, vaginal dryness. And the thing about the diagnosis of perimenopause, it can look like someone who has untreated sleep apnea, right? You can have problems with memory, decreased concentration. It can look like someone who has thyroid conditions, right? It can look like someone who has a rheumatologic condition. So I think it will really take sort of like an astute doctor to try to like sort things out. Sometimes, I think I had a patient that was talking recently. She's like, well, like I'm caregiving for my mom. I'm going through menopause, or I could have sleep apnea. Like, is this causing why I'm tired? I'm like, yes, and it could be everything, or it could be none of the above. So it's something that, definitely you have to sort of sit down and sort through. And I definitely take an individualized approach. So now let's go in talking about the disruptors. A lot of women, so if you're a woman who is going through perimenopause or midlife and you have difficulty sleeping, just know that you are not alone. It's so common. 40 to 60% of women have difficulty sleeping. And the reason why I wanted really to go into, women's sleep is because this number is way too high, right? If we could bring this number down to 25%, that would, sort of make me feel better. But at the end of the day, yeah, I think there's so many good options and just people don't know enough about it. And then, right, if you don't get enough sleep, it's a risk factor for heart disease, diabetes, and weight gain. Some of the common reasons why women have difficulty sleeping during this period of time is, the hot flashes, right? It's so hard to be able to sleep if you're feeling flush, having to change your clothes because you're just stretched. And then mood, right? We get more anxious because we don't even know what's going on in our bodies. So how does perimenopause and menopause affect my sleep? Well, hot flashes, I think, are definitely a big one. Sometimes I wake up for no apparent reason, and that's why it takes, I think, a little bit of a self-assessment to try to figure out, okay, is it because I have a lot of stress going on? Is it because I have to urinate? Could I have undiagnosed sleep apnea? Am I, sort of doing too much intermittent fasting and my blood sugar is going down? Is it maybe because of my homeostatic sleep drive isn't as strong? Right? Is it because I've had too much light at night? Right? There's so many different reasons for this. And that's why I sort of like shy away from people who ask me what a supplement to take for this, because, you know, if you're having a hard time staying asleep because you're worried about your upcoming job project, you know, there's not really a supplement or a pill that can help with that per se. It's sort of like dealing with the underlying emotional issues. And then also, right, if we're at increased risk for having sleep apnea, maybe if you have a bed partner, right? Sometimes it's your environment. If someone's snoring really loudly next to you, that definitely can keep you from falling asleep or staying asleep. So remember, hormones are messengers. And really what happens is as we get older, melatonin does go down, and that can affect our ability to sleep. Growth hormone goes down. And then the estrogen levels go down as well. So estrogen and progesterone levels go down. Progesterone is known as the hormone of sleep. And it's really interesting because they've done studies where they've actually done blood work in women and asked them about their sleep. And from self-reports, right, from questionnaires, they found that lower levels of estrogen or estradiol is how we measure it, were associated with difficulty falling asleep and staying asleep. And then changes in FSH. So FSH is the hormone that goes up, the follicle stimulating hormone, when the estrogen levels are down. Those are associated with poor sleep. But from sleep study data, so instead of just doing a questionnaire, they brought the women to the lab and they took a look at it and they said, whoa, these FSH levels were actually more associated with deep sleep. And it didn't quite match the subjective. And so really what that tells us is that sleep is tricky. So women who had insomnia did not necessarily show changes in FSH levels, and that these hormones are complex. And they play a role, but I don't think we can blame them because they're not the complete story. You know, I think a lot of people want to sort of put the blame on, okay, I'm just getting older, it's my hormones. But yes, and there could be other things going on that we can help address and help you get better sleep. So what are those things? Well, this is sort of a wheel that I created: menopause, perimenopause disruptors, hot flashes, anxiety, depression, sleep apnea, restlessness, environment, right? You know, I've had people who live in sort of busy cities and, you know, they have this bright lamp coming through their door, this bright light from the street coming through, but then they don't want to close their windows because it's so hot and they don't have AC. Ruminating thoughts are definitely a big one. Having a hard time relaxing the mind. I hear this very often for women. My mind is just running and running, and I don't know how to slow it down. I've tried breathing exercises, I've tried yoga, I've tried meditation, and that doesn't help. And then I always go a little bit deeper. It's like, well, what does that mean? You tried meditation, you tried breathing exercises. Sometimes it's like, oh, I've tried it like, you know, 1 or 2 times and it didn't work. So then what are the treatments, right? So if you do have difficulty sleeping, you know, the treatment always depends on, okay, what are you looking towards to treat, right? So if you have hot flashes, herbal supplements can help, right? There are mind-body practices that can help. Hormone replacement therapy actually is really beneficial if you're a good candidate. Antidepressants can help. For mood, right? Exercise, moving your body, going outside, getting that natural sunshine, you know, focusing on gratitude, positive psychology is actually helpful. And the things that you feed yourself, right? The Mediterranean diet, you know, things rich in omega-3 fatty acids, that's actually really good for your brain health. For insomnia, cognitive behavioral therapy, mindfulness meditations, look out, making sure you don't have any underlying mood disturbances. For sleep apnea, weight loss, CPAP machines, mouth guards, sleeping on your side. If you have restless legs that disrupting your sleep, take a look at your iron levels. Stretching can help. Sometimes magnesium can help as well. Magnesium works on the GABA system, which actually is a sleep promoting system as well. So it can have a dual effect. Yeah, and also can relax some of the muscles. Yeah, and so going down to our self-check-in now. So really the question is, you know, I'm having a hard time sleeping, and then I sort of bring back the question to my client or my patient. Well, what is the root cause, right? Are you having a hard time sleeping because there's physical things going on in your body? Or maybe you have some habits. Are you really tired throughout the day that you're drinking caffeine in the afternoon to stay awake, but then that residual caffeine is keeping you from sleeping at night? Are you worried about getting older? You know, some patients are just worried about this whole transition. Sometimes some people, unfortunately, have had parents who've died, you know, early 50s and 60s. And as they're going through that phase, now they're worried, is this going to happen to me as well? Sometimes it's just anxiety about one's ability to fall asleep that can keep them from falling asleep. So always taking a look of what's truly the root cause, right? There's stimulus and then there's a response. So this is actually taken from Viktor Frankl, right? Between stimulus and response, there is that space. In that space, we have the power to choose our response. And in our response lies our growth and our freedom, right? So, difficulty sleeping, take a sleeping pill, right? Difficulty sleeping, worry about it. But can we take that pause? Can we sort of sit back and take that bird's eye view? Oh yeah, maybe I'm not getting enough sunlight in the morning. I hate being outside. Well, okay. Well, up until you're ready to go outside, can you get more light from a light box, right? Can you switch from, caffeinated beverages in the afternoon to decaf, right? Sometimes that habit change can be really small, but if you're able to get 10, 15, even half an hour more of sleep, you're going to feel a lot better. So learning to take that pause between that stimulus and response. And what I encourage a lot of people that I work with is take a look at the holistic aspect. What's going on in your mind, what's going on in your body, and what's going on in your soul.
Absolutely. And we have Patricia asking, have you found hypnosis works with sleep insomnia? And then she's also asking a question about THC gummies.
Yes, love these questions. I love clinical hypnotherapy. So I am trained in it and I do practice it with my patients. So what hypnotherapy is, it's working on your subconscious mind, because sometimes we do have, negative thought patterns that aren't fully aware. And so when you do a clinical hypnotherapy session with someone, you allow them to go into a trance, which is a relaxed, deepened state of awareness. And when you're in trance, you feed positive psychology, right? You are able to sleep. The minute you put your head on your pillow, you're able to feel relaxed. And it really does work well. It works best if you have a recording unique to that person and they constantly listen to it, because then it improves that relaxation response in your brain. THC gummies, it's a mixed bag, sort of like melatonin. It's not regulated, it's not standardized, so it can be super expensive. Some of the research shows CBD and CBN are more helpful because THC can be psychoactive, and for some people, it can be really stimulating. So a ratio of 60-1 or even up to 30-1 CBD to THC is helpful. Another thing, we do have within our body an endocannabinoid system, so receptors for cannabis. And sometimes just going back to the melatonin, taking sleeping pills, your body gets used to it. So if you're on a dose for a while and it's working well, and then it doesn't work well, consider taking a drug holiday, starting off low again, and then slowly titrating yourself up. Your brain needs to be able to build the receptors again to able to get used to it. So I do have some patients who do take it, and that's helpful for them.
I think a big part of it is the fear, right? When I've gone through bouts of sleep apnea, insomnia, it's like there's this anxiety building up as it gets closer to bedtime, and as you get into bed, it's like, what happens if I'm not going to be able to sleep, and what happens if I don't sleep, and if I don't fall asleep? And so that's a recipe for definitely not being able to fall asleep, right? So would again, are you talking about, would that be, if you've now built up this anticipation of not being able to sleep, is that where the cognitive behavior therapy, the hypnotherapy,
the mind-body practices
would come in?
Definitely. And the mindfulness is taking a step back because it gives you that awareness, right? Can I just sit back and notice my thoughts without judging it? Because what happens is when you have one thought, I can't go to sleep. What's the next thought? Oh, my day is going to be ruined tomorrow. I have so many things to do. My boss is going to be mad. It's going to be just awful. How am I going to survive through my day? Versus, I may not sleep tonight, and that's okay. Right? Can you sit with it and be like, it's okay that maybe I won't get enough sleep? Because maybe, you got on a vacation and you were traveling and you didn't sleep well, but you still did okay the next day. Why? Because it was associated with sort of a happy time. Or maybe there was a wedding or a great party and you were up all night and you didn't get much sleep. But guess what? You probably survived, right? You're still here today. So exactly what you're saying, it's our perception, right? Our perception of how we feel, and how we feel, it's so key, but it stems from our thought, because if we have that negative thought, it can release a flood of the hormones, right? The cortisol, the adrenaline, which now our heart is racing, and that sort of begets more fear, right? And so stepping back, taking a look at our thoughts, writing them down is actually really helpful. And then the cognition part is learning how to change it. From anti-sleep thoughts to pro-sleep thoughts.
Right. And then another thing I wanted to touch on that you mentioned, so interesting, the intermittent fasting. I went through a phase. I mean, there are many reasons why intermittent fasting doesn't work for menopausal women, the way it works for men or women in their early, in like their 20s or 30s. But how does it affect sleep? Because I know I went to one stage where I was doing 18-6. I just couldn't sleep.
Oh, interesting.
So what is going on with the intermittent fasting and sleeping? You're saying that it affects your glucose?
Yeah, so we don't actually have a lot of data in this, which is interesting. We have more data in people who are diabetic, right? Because their sugars can go high, they can go low, and that can, disrupt their sleep. The studies that I've seen are actually from Germany, where they actually put healthy adults in a lab. They gave them insulin and they allowed their blood sugars to go low. So induced hypoglycemia, right? When you don't eat, there's no substrate. So your blood sugars can go low until your liver kicks in and says, okay, I need to start making more glucose. So when we induce hypoglycememia, you're not going into the deeper stages of sleep, right? You're not fully resting because, right, you need to be awake, right? Your body needs to survive because low glucose is really bad for our body, especially our brain. Our brain needs glucose, right? And it has been associated with things like dementia. I've seen on the hospital, unfortunately, a case where someone got too much insulin and that their brain was just a little bit fried because they were hypoglycemic for too long. Yeah. So it's a protective mechanism to be able to wake up and your body says, okay, I need to eat. So you don't want to fast too long. It doesn't happen for everybody, but if you are waking up and you are maybe doing some fasting, it may be worthwhile to check your blood sugar, right? Is it in the 50s or 60s, or is it above 100, right? Depending. So it's sort of interesting. Yeah, we don't have a ton of data, but hopefully we're going to have more soon. We don't have any data, at least from in women during this time period. Actually, some of the data we have for women going through sleep disturbances is actually higher levels of glucose, right? Because if we're not sleeping, it's an inflammatory state where our cortisol levels go up and our glucose level can be a little bit higher. Yeah. A good question.
Amazing. So I'm just going to have a look and see if there are any other questions on all the different platforms that we are on. But maybe if you can let people know how they can get hold of you. And
I'm so
glad
that
you're going to be releasing a course soon.
I am. So I think this is a little bit old here, but I didn't update this slide. So I am a medical sleep doctor and my sleep clinic is Sleep Life Med, but my women's sleep platform is sleephoria.health, which I need to update my slides here. Sleephoria, SLEEPHORIA.health. And the course I'm releasing is called the Serene Sleep Solution Program. And it's a 4-week course that is really science-backed, mind, body, soul, holistic approach to care, right? So really going into more detail from the things that I discussed today, things like self-assessments, we'll be doing meditations together. And there's 2 options. There's a self-directed option and then one with group coaching. Yeah, so that actually opens next week. Yeah, I'll start selling that. So if you are interested, head over to my website, sleephoria.health. And I also give, 20-minute consults of anybody, has some questions or you're not sure if this program is for you. Yeah, just send me a message and I'm happy to chat.
Fantastic. Well, thank you so much for coming to
pleasure.
Join us today. It has been so interesting. And if anybody has any other questions, just type #replay and just tag Dr. Val so that she can see that you're asking a question. And really, just happy sleep.
Reach out. Sleep
is
well. I love talking about women's sleep, so no question.
Absolutely is, right? And many women who go through my reshape method say that it has changed their sleep, because what we're doing in my approach is getting the right amount of exercise at the right time. Because as you said, getting too little can affect your sleep, and getting too much or types that really spike that cortisol at the wrong time can really interfere with your sleep.
Exactly.
Plus we need the right kind of movement to actually just lower the cortisol
Mhm.
and bring down the stress in the body. So I love the interlap
Definitely.
that we have. I mean, the overlap between my approach to movement and your approach to sleep. So thank you so much.
Thank you. I'm so honored to be here
Nice.
and talk to you.
And feel free to go to all the different platforms, Facebook, YouTube, and LinkedIn, and just drop your links there so that people can find you easily.
Oh, wonderful. Thank you so much, Tracy. Have a great day. Enjoy your weekend. Sleep well, everyone.
All the best.